Hi everyone, Professor Novak here. Today we are going to be learning about how to start an IV on a patient, which is a very exciting skill for students. If you have already tested off on this, congratulations. Now you can do it in clinical, which is awesome. This is one of, I believe, the most important skills that you will learn as a nurse. All of our patients need IVs, especially in the inpatient setting, so you will get better with time. Just give yourself a little bit of grace. But here in the lab for the check off, we do have a check off sheet, and we do like you to go in order just to make sure that you are safe and that you don't miss anything. So let's go ahead and get started. So you will be set up with an IV arm, and you will have these little like crayon boxes that will have all the supplies that you need. You want to make sure you have an arm and that your blood is turned on. You're also going to need a sharps container. You're going to need hand sanitizer, gloves, and the patients are already draped, but we want to make sure that there's a little extra drape underneath of the arm. Now, when it comes to the occlusion part, trying to occlude on these arms can be a little difficult. So you will notice that the blood does come out pretty quickly. So try not to stand too close or else you might get your white scrubs dirty. So just be mindful of that. So before I start, we're going to take from the top. I'm going to gather all of my supplies, come into my patient's room. Hi, I'm Gina. I'm going to be your nurse today. Going to wash my hands, apply my gloves. Can you tell me your name and date of birth? I'm going to confirm that with their wristband as well. Do you have any allergies? No? Okay. I'm going to be starting an IV on you today. And remember, there's a few things that we want to make sure that this is not their dominant hand. They don't have any sort of AV fistula or graft, no mastectomy on that side, that this doesn't have weakness from a CVA. And we also want to make sure that there is no signs of infiltration in that arm or any sort of pain on palpation or anything like that. Okay, so I have my gloves on. The patient is already draped. Okay, so we already have that on. So I'm going to open my supplies here, and inside of my IV start kit is going to be a tourniquet right on top. Okay. Going to unroll my tourniquet. Remember, we want to go 4 to 6 inches above our proposed site. I do not recommend going above the rubber band veins in here. It actually causes a huge mess. So we're going to go 4 to 6 above the patient's antecubital space. I'm going to tie my tourniquet so that way I can have a quick release knot. Okay. Now I want to find the patient's vein, typically with my index finger. Don't like to use the thumb because your thumb has a pulse, okay? So I'm gonna feel, I want something nice and bouncy, nice and squishy, something that bounces back, okay? Nothing that's hard or almost seems bony in a sense. We would never want to go there, okay? Once I have my proposed site, I'm gonna remove my tourniquet, okay? Because remember, once I clean the site, I don't want to touch that again with my gloves because my gloves are considered dirty at that point, okay? So I know which vein I would like. Now I need to prepare my supplies. So your table is going to feel a little bit cramped, so I recommend that you prepare your supplies on your drape and then get rid of your crayon box so it doesn't throw you off, okay? So what am I going to need? I'm going to need a 20 gauge angio. I'm gonna open that, throw that trash away. I'm also going to need my saline flush and my J-loop. So get rid of your air. Some of you may not have an end cap on this. Just be mindful of that, okay? I'm going to make sure there's no air. Prime that through, okay? Now, my start kit, everything that's in my start kit, I'm probably going to need. So let me just move my box to the side. I'm going to dump out all of the contents in my start kit onto my drape, okay? Now, the end of this cap, you have two options. You can loosen it and keep it on, or you can completely remove it. And remember, the inside of my start kit is sterile if I haven't touched it, so I can just set it right in there for when I'm ready to use it, okay? The gloves we're not going to need. I have my individual roll of tape. I have my IV dressing, which is going to remind me to initial date and time at the end. I'm going to peel back just a small portion of that just to make it a little bit easier to get off, okay? And I also have my ChloroPrep, okay? I do have some gauze because once we get this IV, the blood is going to come running, so we definitely want to make sure we clean that blood up before we put the dressing on so that we can ensure that it sticks, okay? So now I have all my supplies ready. There's nothing extra on the table that can distract me, so this helps me to get ready for this, okay? Now, I'm going to crack my chlorhexidine. Shaky, shaky, shaky. I want to clean for 30 seconds, okay? So I'm going to do my circular motion for 30 seconds. And we want to allow this to completely air dry. We do not want to fan it. We don't want to blow on it, okay? Complete air dry, okay? Once I'm dry, remember my tourniquet is still here, but it's not attached, okay? That's a reminder that I need to put it back on the patient, okay? So at this point, I'm going to reattach my tourniquet. I already know where I'm going, but I don't want to touch it, okay? I just cleaned it. So if for some reason you cleaned it and then you forgot where you were going to go and you touch it, you're going to have to clean it again, okay? That's why there's extra alcohol preps in the box if you need them, okay? So now I'm ready for action, okay? So I'm going to take the cap off of my angiocath. And remember, we want the bevel to be pointing up. And we want to make sure that that needle is seated nicely, coming through the edge of the catheter there, okay? I'm aiming for a 10 to 30 degree angle. Remember, we don't want to be nose diving into these patients' arms. We like to keep the angle relatively low, okay? So in order to prevent rolling, I'm going to stabilize above where I cleaned, okay? So I'm not touching where I cleaned, okay? So I'm stabilizing my vein so that it doesn't roll. And now I'm going to insert, okay? I felt that pop. Now remember, the first thing we want to observe for is blood in our flash chamber, okay? That tells us that we were inside of a vein. But we are not done here, okay? In real life, we would thread the catheter all the way, and that's the goal here in the lab, but sometimes it's a little difficult to thread these because the arms are made of rubber, so a little difficult, okay? But we want to make sure we thread that catheter and bring that all the way to the hub. You shouldn't see any exposed straw, essentially, okay? Once I'm at this point, I know that as soon as I retract the stylet and get ready to pull it out, I know the blood's coming. I can try really, really hard to stop the bleeding, but it's going to come. So be prepared for that, okay? So I'm gonna grab my colored portion of the catheter, my straw. I'm gonna pull back till I hear the click, okay? Now, as soon as I undo this, the blood is coming, so I know that my saline lock and my whole setup here is within reach and easy access, okay? So I'm gonna pull that out. The blood's coming, okay? It's coming fast. See, I can't stop the bleeding. Straight into the sharps container, okay? Attach my saline lock right away, righty-tighty. Make sure it's on there nice and tight, okay? Clean up my mess here. Okay. Once my J-loop is on, and this is where a lot of students unfortunately end up failing this skill. Once my J-loop is attached and there's no more blood coming out, I need to undo my tourniquet, okay? That tourniquet is not helping in terms of stopping the bleeding. It's actually making it worse, okay? So I want to take that tourniquet off. And at this point, I need to check for a blood return, okay? So we are going to aspirate and see how there's blood coming into my catheter. I don't need to pull it back into the flush, okay? I just need to see it in my J-loop. I'm going to give it a 3 to 5 cc flush, okay? Beautiful. It tells me that I'm inside of the vein, okay? While I'm flushing, I want to make sure that I lock my line, okay? We want to prevent backwards blood flow and prevent anything from going into this line, okay? If I've made a little mess, now would be a good time to clean it up because the next step is going to be putting the dressing on, okay? So here's my dressing. Remember, we don't want to cover the part that screws onto the hub. We only want to cover the colored part, okay? So I only want to put this dressing over the pink. So that way, the next nurses that come on, or that way when I'm checking my IV, I can make sure that that connection is tight and not underneath of my dressing, okay? I'm gonna place that on my patient. Sometimes they won't stick well. Remember, they're rubber arms, so they might not stick well. Okay. 2 options. You can initial date and time right now while it's in front of your face, or you can do it after you've taped your whole line down, okay? So unscrew my flush, sharps container, okay? Grab my tape. Now I need to create my J-loop here, okay? I want to make sure that I stabilize this enough so that way when the patient moves, there's no risk of this IV flying around or moving or anything like that, okay? I want to initial date time. Some people write the gauge as well. Put that on there, okay? That way we can always assess and see when the line was placed, okay? Throw away any extra trash that you might have. And make sure your patient is in a safe position, bed down, tall light within reach, gloves off, hand hygiene. If you have any questions on this skill, you want to get extra practice, we are here Monday through Friday. Just make sure that you check with one of the lab staff to make sure that you can come into the lab and practice. But we do encourage you to do this. During senior proficiency, you will not be starting any IVs, but during simulation, you may have to start an IV on the patient. So just be prepared for that, okay? Thanks for watching. We'll see you in the lab.